Where does it all end? Let's ask two congressmen involved in the debate, Republican Representative Phil Roe of Tennessee and Democratic Representative Joe Sestak of Pennsylvania. We should mention that Phil Roe is a medical doctor as well. Well, Dr. Roe, let me go to you first because you have looked through this thing and focus on individual pieces of it that do seem unrelated to the causes for health care reform in the first place. Why don't you point out some of those items that probably don't deserve to be in this bill?
David, thanks very much. Before, as a U.S. Army veteran and as a parent and as a member of Congress, I want to pass my condolences to the families who were lost at Fort Hood. And I mean, it just breaks my heart to hear something like this. And I certainly pray and hope that these families these folks that are wounded will be healed, and our prayers are with them. And we had a moment of silence on the House floor tonight, and it's just a very somber moment.
Well, and in fact, Congressman, Doctor, if you can hold on, because I know you both are veterans with distinguished records. Congressman Sestak is a former Navy admiral. Go ahead, Congressman. I'm sure you want to put in your words about what happened in Fort.
Yeah, without a question. You know, on our shopping bags, the commissary bags that we had in the military, there was this wonderful slogan on it that said, "Military spouse, hottest job in the military." And so I think as we hear of these deaths here, we keep in mind our military families, because only 1/3 of 1% of all of America's families are directly involved in 2 wars overseas. It's a tragedy that it takes a tragedy to highlight how much we owe these families.
And we are all together on that. Before we get into anything divisive about health care or anything, we wanted to emphasize that this is something that as a country we are united in. All of our condolences for what's happening in Fort Hood. But now on to the issue of health care, if you don't mind, gentlemen. And first to you, Dr. Roe. Again, specifics in the Pelosi bill that probably shouldn't be there.
Well, you know, there are a lot of things, David, that are in there, and I have copies of the bill here. And I was just amazed last evening when I started to read this. I've got through the first 1,000 pages multiple times, and I'm working my way through this one. But, you know, we have, when you start mentioning single menu items as soft drinks and pizza and donuts, I mean, what in the world is that doing in a health care plan? And as a former mayor, I mean, I think it's wonderful that we talk about the sewage system somewhere, but we've got mentions in here about the function of the sanitation facilities in tribal areas. And then we have in the manager's amendment, which I haven't read yet, I haven't gotten a copy of it yet, but we've got tax breaks for biofuels. I mean, what is that doing in a health care bill? So we could simplify this bill very easily, and I have spent hours, David, thinking about this. It's gotten too complicated. I mean, it's way too much verbiage, 2,000 pages. The people out here don't understand it. I'm finding something new like this. I could go on and on and on, but that's the problem with the bill. It's too complicated, too big, and it's incomprehensible in my opinion.
Congressman Sestak, wouldn't the first step be just to cut it down, to cut out all but the essentials?
Well, I think the first step might have been a recognition that over the last 8 years, nothing was done. Not even a single piece of paper by the other side was ever submitted. And we had 8 million Americans that lost their health care during that period of time. And in my state, we had premiums double. So what we did, and I've seen many thick things, for instance, when my aircraft carrier launched aircraft, that took an op order about that thick. So I'm not dismayed by that. It is a complex issue, and it takes complexity to kind of sit down and do it. But what the bill does is this. It actually says that the insurance companies that have a fiduciary responsibility to their shareholders actually can deny coverage for pre-existing conditions. It can actually, once you get sick, go through your paperwork and see if you made a mistake in the administration, filling it out, and can deny you coverage. We stop that. We say, no, everybody gets the same benefits as Congress members. Then what we do is we cover everyone. Why? Because Phil and I pay about $400 more a year for the uninsured when they go into a emergency room that passes on an insurance company because they don't want to eat it, and we pay for it. So we're paying for it up front. So what we say is, without adding a cent to the debt in the reform bill itself, that we actually are going to cover those Americans so that we pay for it directly up front, and eventually, over time, Because of preventive screenings, we should pay less if we catch the woman's cancer early.
Yeah.
That's what we do. And yes, it's a complex approach, but you know what? Doing nothing has meant 8 million Americans.
Well, and Congressman,
have lost their
I
healthcare
understand,
insurance.
and you bring up some excellent points, but when you hear Congressman Rowe bring up issues that, you know, frankly, are making the Pelosi bill a laughingstock among the American people. I don't know if you guys get out in the hinterlands, but when you hold a 2,000-page document that talks about donuts and biofuels and things that are not as important and not as pertinent to the issue, Congressman Sestak, as the issues you were talking about, why don't you cut that out before you vote for it?
Well, because it's very important that, and every doctor I know has said this, that when we see 23% of the kids graduating from high school today don't qualify for the military Phil and I are in because they're overweight or other reasons, that when we describe in this thing that we're going to begin wellness programs, we want to cut down on carbohydrates or other issues. Yes, we want to explain that in the bill. And how can we incentivize better behavior that focuses on the individual but is allied with the common enterprise of the common good to give us healthy youth that can actually protect us.
But Congressman, well, the thing is, we as a nation are fed up. We are fed up with tax codes that are 50,000 pages long. We're fed up with bills that are so big and so involved that the congressmen themselves who vote on them can't possibly read the whole things. If you were just to boil it down, maybe you have some key issues that both of you could agree on and boil it down to the essence of that, that would be something we could understand, but not 2,000 pages.
David, absolutely. Let me just give you a couple of things that would be very simple to do, and I've spent a lifetime thinking about this. And one of the things that I totally agree with Joe on here is, number one, is that on pre-existing conditions, we need to be able to do something about that. And how do you do that? Well, you can do that without thousands of pages. The group market doesn't have a problem. A large group market doesn't have a problem with pre-existing conditions. It's the individual, like I was last year when I ran for Congress, and small business. Well, how do you take care of that? Eliminate state lines. I've got a city, Bristol, Tennessee, Bristol, Virginia. I mean, why in the world is your insurance different in Tennessee and you step over one step and you're in
that's
Virginia?
One issue, and frankly, we could get caught in the weeds of it, but you got to boil this thing down, Congressman. Otherwise, the American people are just going to keep voting you out of office if you keep sending us 10,000-page bills. But listen, gentlemen, we had to truncate this segment because of what happened in Fort Hood. And again, we really do appreciate your condolences and appreciate you coming in light of what's happened.
Thank you.
Thanks, David.
Thank you both very much. Well, the American